and I'd really like to thank Fionnuala Duffy, the Head of Speech and Language Therapy from Vincent, for speaking with me today. Fionnuala, I was wondering, what is your idea of patient experience and how does it differ from patient satisfaction?
I think patient experience is a more in-depth look at how the patient perceived their care, and because it's going to happen after they've been discharged, they have that bit of time to reflect on it. And I think the questions in this particular survey are taking them on their whole journey through the system, from being admitted right the way through their care in the hospital as an inpatient and their discharge. And even, one of the important things is when a patient is discharged, did everything happen? Did their follow-up appointments? So they will get to have a commentary on that as well.
Great. And what do you think are the benefits of collecting this data across all the acute hospitals in Ireland?
I think it's important to be doing it nationally, and that it's been done not by the hospital itself, that it's been done by a national organisation that's separate to that, and it's a joint initiative between a few organisations. And I think for us to learn from one another, to benchmark what are good standards of care, and with this particular survey, we're actually asking patients for their ideas of what their care was. So we're asking them to give us good practice and then the not so good, the difficulties that they had with the care they received, and that's what we're going to learn from.
Great. And how do you think you might use this information as Head of Speech and Language Therapy?
I think it is good for us to reflect, because a lot of the time as clinical people, we're very focused on our clinical outcomes. So did the treatment that we provided improve your voice, your quality of life from a communication or swallowing point of view? We're maybe not looking at the overall experience of the patient throughout the system. So I think this survey and the results from it will give us an opportunity to look at the bigger picture of where we fit into the patient's journey.
Great. And can I ask you, do you currently collect information on patient satisfaction or feedback on patient experience?
No, I think that's something that we're not good at, Tracy. I think we've got to remember when one patient leaves, there's another patient in that bed. So from a time factor, we do tend to focus very much on the treatment outcomes. We, of course, listen to our patients if there was a complaint or if there was something positive. We reflect on all that, and we would try to work with others as an MDT to rectify any issues that patients had and that they wouldn't happen again, but we're not really good at that. We have accreditation here where we do tracer audits, and that's a good way of finding out, you're looking at a patient's journey, but it's only a glimpse and it's not their perception.
Great.